toe assessment. So first thing I would do is I would knock and enter the room and introduce myself. So, hi, I'm Katie. I'm going to be your nurse today. I'm going to do a head to toe assessment. What's your name?
Emmy.
Good job. All right. So first I would ask for her. I'm going to wash my hands. And then I'm going to ask who our visitors are, which we don't have any here right now, but if her parents were in here, I would get consent to do a head-to-toe assessment on her, and I'd also ask Emmy. Emmy, is it okay if I do a head-to-toe assessment on you? Yeah? Okay. So now I'm going to check her wristband. Let me see your arm. All right, and make sure that I have the right patient. And I'm going to ask if you have any allergies. Do you have any allergies, Emmy? No? Okay. So next thing I'm going to do is, I've obviously got gloves on, but I don't have any gloves here, so we're just going to go with this. First thing I'm going to do is ask you, how are you feeling today, Emmy?
Good.
Are you good? That's good. So now she also is responsive to any kind of stimuli, so she's wiggling around here, so obviously her legs and arms are working pretty good. Her eyes are moving around, and she can talk to me, so that's all good. So the first thing I'm going to do is check out your head. Make sure she has no lesions, bumps, abnormalities on her head, and she doesn't, so she's good. Next thing I'm going to do is check out her eyes. And she has perla, which is pupils equal, round, and reactive to light and accommodation. Then I'm going to check out her nose and make sure there's no kind of nasal flaring going on. And her nostrils are good. Say, ah! Alright. And then I just checked out her oral mucosa to make sure there was no abnormalities there, and it's not. Her oral mucosa is pink, moist, and intact. And now I'm going to check out her ears. And since she is older than 3, we're going to pull up instead of down. And I'm looking for any kind of drainage or inflammation. And she does not have any of that. So now I'm going to check her vital signs. And the blood pressure cuff is too big for her because I do not own a peds one. But if it worked, we would put it there. And it would tell us that her blood pressure is 110/60. And I'm going to check her temp. And her temp is 98.8. And now I'm going to check her pulse ox. And it is reading 99% on room air. So now I'm going to take her apical pulse, and I will take it for 1 full minute. So. And her apical pulse is 70, and I would just keep this here, and simultaneously I would take her respirations at this point after the full minute of the apical pulse. So after 1 minute, her respirations are 18, which is normal. So now I'm going to listen to her lung sounds. So I'm going to listen to them in the front. All right, that's it. I'm going to have you sit up for me, Emmy. All right, and her lung sounds are clear throughout. So now I'm going to raise her shirt up just a little bit to look at her belly. I'm going to look and make sure there's no kind of swelling or anything going on. So now I'm going to listen to her bowel sounds. And her bowel sounds are active in all 4 quadrants. And now I'm just going to feel of her belly to make sure there's no hard spots or anything like that. And she is good. So now I'm going to check her skin turgor. I'm going to check it up here. And it's brisk, less than 3 seconds. And I'm going to check her cap refill. And it is less than 3 seconds, so it is good. And now I'm going to check my Emmy's pulses. So I do her carotid on this side, and then this one, And then her brachials. Check hers. Her femoral. Popliteal. Alright. And all of her pulses are good, +2. Right. Next, I'm going to palpate her lymph nodes to make sure there's no swelling. And I'm going to ask, Emmy, have you pooped today? Awesome. So she has had a bowel movement, and if we were in a normal hospital setting, I would check her bowel movement for color, odor, and consistency. And I'd also do the same thing for her urine. And so now I'm going to have Emmy stand up for me. Stand up. You can talk. All right. So her gait is steady. And I'm going to have you hold on to this pole right here for me. And bend over a little bit. I'm just checking her spinal alignment, and she has no curvature, so she's good. Do you have any pain in any of your body parts? No. And there's no edema in her legs, so she's good there. And so I'm going to, at this point in time, I would assess her genitalia for any kind of rashes or drainage or trauma. But as of right now, Emmy does not have any of that, so she is good. Ain't that right? Let's see. So I'm also going to check her range of motion. So bend that knee. So she's good here.
That was mine.
Oh, you busted Emmy's balloon. Alright. So her range of motion is good in all her arms. Alright. Alright, and the next thing I do would be take off my gloves and wash my hands, and I report any kind of findings to the, any new abnormalities or anything to the parents and give a report from that. And then I would exit the room and report, or I'd lower the bed, attach the call light, and then leave the room.